Hi and hello. Now I'm gonna show you how to perform collateral ligament taping. So this is the options to prevent further injury of MCL tear, which is medial collateral ligament. Okay, this is the area of the injury part. We can see the ligament is crossing within the joint. Normally, MCL tear is causes of strong force hitting the outside of the knee. Okay, now I'm gonna show you step by step. For this technique, we are gonna use the strapping tape to provide rigid support and restrict the movement. For the first step, we will go above the kneecap and we will make the anchor. Make sure don't get too tight to ensure that the blood flow go efficiently. Next anchor will be located at the head of fibula. Then, I will put two crosses pointed at the lateral ligament. Lastly, we make the anchor again at the bottom and above the kneecap. Okay, that's how to perform collateral ligament taping.
Assalamualaikum. So for the next technique is the rotary taping technique. Before we get to know the technique, we need to know the anatomy of our knee. So the most common part that we injured is the PCL, ACL, and also the MCL. Athletes who are involved in the sports such as contact sport and also the extreme sport are common injured at the ACL and also the MCL. So before we move on to the procedure, you need to know the equipment. First step for the rotary technique is to cut the kinesiology tape at the middle on both sides. Second step, using the K-tape, start from the posterior of the knee and to the upper and lower part of the patella. Third step, starting from the lower part of the patella, rotate the K-tape around the knee and end at the upper part of patella on both sides. This is the last part of the rotary technique. This will act as an anchor.
Bismillahirrahmanirrahim. Assalamualaikum. Alright, so I'm going to show you how to use McConnell knee tape. Alright, this is really easy technique to take the pain away. So it's only needed a strapping tape, basically. Alright, strapping tape. Okay, basically going to run from two fingers outside from your kneecap and it's going to go up and over your knee. Then round to the back of the hamstring area. This is a little lump of muscle that sits at the back and that's where the tape going to go. Alright, so now I'm applying with no tension over the middle of the cap and the kneecap again, starting from two fingers over the middle of the kneecap and push on with no tension. Alright, remember, no tension for this first layer. Alright, so basically I'm done some research about McConnell tape technique. There's some video show they are using just one tape to lock that patella area, but this technique is from the latest video that is established 2018. So the video show how to lock our patella area like that, still called McConnell tape technique. Alright, so now the second time we use the tip is the one that really help guide the patella and takes the pain away. Alright, gently, not too tight. Remember, if too tight also is not good for our injured area. Okay, alright, So this is the technique. Alright, so alright, I'm gonna lock it. Okay, good. And I'm gonna put the second tip on the other area just to make sure it is locked nicely and gently. Alright, we can see the patella. Alright, see? Okay. Alright, the whole point about putting the tape on, meaning we're doing this technique is in order to choose activity with squat or lunges movement, so it should be 50% less pain from before when we use this technique. And there you go. Alright, so let's recap together with 5 simple steps.